Segment is sponsored by West Hills Behavioral Health Hospital.
Well, as we learn more about the dangers of addiction and overdose with opioid painkillers, people are searching for alternatives for chronic pain. News 4's Shelby Sheehan joins us now with a Reno doctor who is finding ways to treat patients without them.
Well, as we've learned how addictive and sometimes deadly opioids can be, both patients and physicians have been looking for ways to treat severe and chronic pain without turning to these types of drugs. Joining us is Dr. Dennis Patterson, a pain management specialist here in Reno. Dr. Patterson, thanks so much for joining us. There's been a real shift to try to find alternatives to opioids when it comes to treating this really bad pain. What do you recommend for patients who come in and who are really hurting?
Basically, when I see and evaluate patients, I kind of think of 5 different things that I can do to help them out. One would be modalities. I don't know if you've ever heard of TENS units, but it's kind of like external stimulation units to see if that can help their pain. Second thing, I look at medications. It can be anything from over-the-counter medications to prescription medications, and I try to maximize all alternatives before I consider an opioid for patients.
So when you're looking for something that is, you know, we know opioids are definitely powerful, they work, they just have a lot of dangerous kind of side effects really. What are you looking at if someone says, you know, this is chronic pain, this is bad, the only thing that touches it is, you know, are these types of drugs? Are there any other options for them? You've kind of looked into something exciting right now.
Yeah, and unfortunately, you know, those options that I just talked about are passive treatments. They're not curing anything, they're just covering up the pain. So I looked at getting my patients involved in active treatments. And what I mean by active is things that may cure them of the problem. So one, I'll look at different types of therapies, whether it's massage therapy, physical therapy, occupational therapy. I look at certain injections. You know, sometimes a simple injection may relieve the pain. Other times there's no simple solution, and I look at devices like spinal cord stimulation in order to alleviate the patient's pain and help them out long term.
Yeah, let's talk about that. You just participated in the springtime implanting a device that basically, it sounds like it kind of tricks the nerve into not firing as much. Can you tell us about that? You implanted a device, actually.
Correct. So what the device was, it's called a spinal cord stimulator, and what it does is it helps neuropathic pain. These devices have been used for a very long time, but we've never really looked at long-term outcomes with patients. You know, we've always tracked patients for 6, maybe 12 months, and in some cases 2 years. This time, I was the first one to enroll a patient where we're going to actually look at their long-term outcome for 5 to 10 years from now to make sure the device continues to give them pain relief.
And what type of a patient would be perfect for this type of procedure?
Yeah, any patient who has chronic nerve pain. Typically it's somebody who's had a back surgery that they continue to have pain, a pinched nerve down their leg. You know, if somebody's got diabetic neuropathy, you know, they've got
really a
burning.
wide variety of pain issues.
Yes, there's a lot of different options or treatments for patients.
All right, well, Dr. Patterson, thank you so much for coming in. We appreciate your time. If you'd like more information on Nevada Advanced Pain Specialists, we will have their website linked to this story. Just go to mynews4.com and click on the Addicted Nevada link. Some great options to look at. Thank you for coming in.
Thank you for having me.
All right, and as part of our ongoing Addicted Nevada series, you can always head to our website, as Shelby said, to find the latest on available resources in the area, as well as you can watch any of our interviews and stories there. Just head to mynews4.com for that.